The following information will provide practical tips and tricks for patients who are receiving NATROX O₂ therapy for chronic wounds. It's important to remember that NATROX O₂ is a continuous topical oxygen therapy and is meant to be kept on 24 hours a day, 7 days a week. Your NATROX O₂ kit will include a supply of packaged oxygen delivery systems, or ODS. The ODS will need to be replaced with each dressing change. If the ODS are being kept in your home, it's important to bring one with you when visiting the clinic for your wound care. One of the many benefits of using NATROX O₂ is that it's easy to use. There's no on-off switch to worry about. Instead, a green light will start flashing after connecting the charged battery. This lets you know that the device is working. If the green light stops flashing, here are some troubleshooting tips. Check the battery to make sure it hasn't become dislodged. If the green light is still not flashing, swap the batteries. A fully charged battery should last at least 24 hours. If the green light doesn't start to flash again, contact your clinical team. To maximize the effectiveness of the treatment, follow the ABCs of NATROX O₂. A. Always have a battery on charge. B. Battery needs to be changed every 24 hours. C. Check that the green light is flashing on the NATROX O₂ oxygen generator, or OG. In the first 2 weeks, you may notice an increase in drainage, and the wound may appear larger. Don't be alarmed. This is typically what is observed with NATROX O₂ therapy. The drainage and wound size should decrease as healing progresses. Adjust the tubing so it is comfortable. Make sure the tube is not pulling too tight, as you do not want to disconnect it. If the tubing is bent, it can restrict the flow of oxygen. For this reason, it's advised to position the device so that the tubing doesn't bend or kink. When positioning the tube, avoid sitting, standing, or resting on it during the day. For example, try not to place the tube behind your thigh. Also, it's best to avoid placing the tube where it may create discomfort or prolonged pressure on the skin. There are several ways to wear the NATROX O₂ device. On a waistband using the flap on the back of the holster, under pants or a skirt using the leg strap, tucked into a stockinette or sock, or in a pocket. Just be sure to place it upside down to keep the tube from bending or kinking. For more information on carrying the device, please watch the Using the Holster video. The NATROX O₂ OG device will need to be disconnected before taking a shower or bath. To do so, twist the lure lock counterclockwise, then place the device in an area where it won't get wet. The NATROX O₂ ODS and dressing will stay on during showering or bathing. However, you'll need to avoid direct exposure of the dressing and the ODS tubing to water. The goals are to prevent water from getting into the tubing and keep the dressing from getting wet. After your shower or bath, reconnect the ODS by turning the lure lock clockwise. NATROX O₂ is compact and lightweight. The system operates silently to encourage a restful night's sleep. Be sure to place the device where you are least likely to sleep on top of it or cause the tubing to kink or bend. Remember, the flashing green light will indicate the device is working. NATROX O₂ can be worn during air travel. However, choosing to travel during treatment should be done so after discussing it with your wound care provider. If required, an air travel information document is available to share with airport security. This document can be downloaded from the patient FAQ page at www.natroxwoundcare.com. For more information on your NATROX O₂ device, view the FAQs under the patient section at www.natroxwoundcare.com.